Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm County Mayor Randy Porter. This is our COVID-19 coronavirus community update for Tuesday, April 21st. Today, as of 2 p.m., our total number of confirmed positive in Putnam County is 95, which is one less than yesterday. Let me explain. Remember, the positive cases are based on county residents, regardless of where the people are tested. With so many tests being completed, there are going to be errors on the county of residence. So we had one that was listed for Putnam, but actually lived in another county. That was corrected in today's number. We also have had 3 deaths, which we told you about last week. All 3 of those were from Signature Healthcare. Please keep those families in your thoughts and prayers. So let's break down our numbers. In the past week, we have only had 3 additional positives, which is very good. Our number last Tuesday was 92, and today we're at 95. Also remember that over 50% of those were the Signature Healthcare patients and workers, where everyone in the facility was tested. Also in Putnam, we have completed much more testing than most of the other counties our size based on population, which of course is going to result in more positives. In the past 2 days, our health department alone has tested over 200 people. I'm not trying to downplay our numbers. I just want to be as transparent as possible with you so that you understand them. Right now, it appears what we have been doing, Mayor, as a county is working.
Yes.
And we want to continue to work to keep our numbers down. There are some positive signs also on the state level. The total number of positives for Tennessee today is 7,394, which is 156 more than yesterday. By my stats, that is the smallest increase we've seen statewide in several days. Also, another positive sign is the number of people statewide that have recovered from the virus, which today is at 52%. The other counties in the Upper Cumberland that have confirmed positives are Cannon has 8, Clay County has 5, Cumberland County has 55, DeKalb County has 10, Fentress County has 4, Jackson County has 6, Macon County has 30, Overton County has 7, Smith has 11, Van Buren has 1, Warren has 4, and White County has 4. As a reminder, the drive-through testing clinic at our health department here on County Services Drive is still in operation. The schedule this week continues to be Monday through Friday, 9 a.m. to 3 p.m. And remember, the testing is free. If you want to be tested, just drive by. They are testing anyone that wants to be tested. Again, Putnam County has 95 confirmed cases, which is one less than yesterday, but that was an error in the registering because it's based on the county of residence, so that's the reason we went down 1. Mayor Shelton.
Thanks, Mayor. The governor announced yesterday that his stay-at-home directive will not be extended and will end April 30th. Over the next few days, he said he will announce about the reopening of businesses by May 1st and some by April 27th. The fact is, we all still have freedom. Freedom to follow directives or freedom not to, and consequences of our actions. We've said all along to please listen, follow the directives, take personal responsibility, heed the guidance from experts, and use common sense so that you can protect yourself, your family, and everyone else. There are no easy, clear-cut answers to this situation. On one hand, there is a virus that not much is really known about. It can kill people, spread easily. You can have it and not know it, or have symptoms, and there is no vaccine yet. On the other hand, there's an economic shutdown with issues: unemployment, closed businesses, depression, poverty, suicide, domestic violence, hunger, and substance abuse. I've heard from many people, frontline medical personnel at CRMC, pastors from local churches, business owners that are still open and some that are closed, employees still working at a location or working from home, and some that are out of work. There are folks that received financial assistance and some that didn't. There are some emphatic on staying closed and some absolute that things must open. My point, everyone has the right to their opinion and beliefs. I believe the path forward is somewhere in the middle, like driving a car with a foot on the gas and the brake at the same time. It shouldn't be a political decision. It needs to be a people decision. We must manage and mitigate health and safety of our people while we open back up our economy and businesses and get our people back to work safely. Daily, hundreds have continued to shop at Lowe's, Sam's, and Walmart. A small business open with 3 to 7 people in it poses even less of a risk. As things begin to open, remember, you still have the freedom to choose. You can choose to shop there or not. You can choose to eat there or not. You can choose to attend church there or not. If you don't think it's safe, or you don't think the location is being socially responsible, don't go. Or if you want to stay at home, you can stay quarantined, you can avoid crowds, then that is exactly what you should do, stay home. I think we all realize there will be a new normal. Some of the measures, physical distancing, wearing face masks or covering, and sanitizing, may need to be part of this new normal for some length of time. Now let's get an update from State Senator Paul Bailey.
Thank you, Mayor Shelton, and thank you, Mayor Porter. I appreciate the opportunity to be with you each week to give an update on the state. The Tennessee Department of Health reported there have been 7,394 total confirmed cases of COVID-19, with 3,828 people that have fully recovered from the virus in Tennessee. Statewide, 157 deaths related to the coronavirus have been reported. In total, there have been 760 Tennesseans hospitalized from the virus. And Mayor, I'll say, based on the numbers that we had originally been given, that is an awesome number to see.
Yeah.
Obviously, one is too many, but when we see only 760 Tennesseans statewide hospitalized, that's a very, very good number. Yeah. This weekend, 11,000 Tennesseans received free testing for COVID-19. Expanded testing will continue for the next 2 weekends, April 25th through the 26th and May 2nd through the 3rd. In addition to drive-through sites, all rural county health departments offer free COVID-19 testing 5 days a week. As of today, 108,182 tests have been conducted. And for 17 consecutive days, we have seen only single-digit increases in the number of cases in our state. Our hospitalization rate has consistently remained lower than national averages, and our number of recovered patients now exceeds the number of active cases. Yesterday, Governor Lee announced that the Safer at Home order will expire April 30th, and the phased reopening of Tennessee will begin next week. The vast majority of businesses in 89 of Tennessee's 95 counties will reopen on May 1st, with some slated to open on Monday, April 27th. Governor Lee appointed an economic recovery group composed of 30 leaders from the public and private sector to craft guidelines to assist businesses in a safe reopening. The industry representatives participating in the group represent over 140,000 Tennessee businesses that employ over 2.5 million Tennesseans. You are encouraged to give your input on how the state can reopen through the Tennessee.gov website, that is tn.gov website. Feel free to share your thoughts regarding the restarting of Tennessee's economy. Please know that COVID testing will be an important part of rebooting the economy, especially when businesses are reopened and the virus is more likely to spread. All businesses and individuals should continue to adhere to CDC guidelines regarding social distancing, washing your hands, and not touching your face. Now, Tennessee state parks will reopen, and most of those 56 state parks will reopen this Friday, April 24th, for day use only. Specific details on which parks will reopen will be available on TennesseeStateParks.com this week, but this will not include Cummins Falls or Burgess Falls state parks. Facilities and gathering areas, including pavilions and playgrounds, will remain closed. Cabins, lodges, restaurants, campgrounds, and group camps will also remain closed. Remember, overcrowding may cause parks or portions of parks to close again. Although there is a lot of anticipation regarding the reopening of Tennessee, please know that each of us should continue to do our part to stop a resurgence of the virus. Mayor, that's my report. Thank you.
Thanks, Senator Bailey, and we appreciate you coming and being with us today and bringing us the update from the state. We continue to remind you about our tornado cleanup as part of our daily updates. If you own property in the tornado damage zone, we need you to get your debris out to the county right-of-way by the street. For whatever reason you cannot get your debris removed, please contact us at 931-646-4636, and we will try to help you. Our survivor organizations have determined that May 2nd will be the last day that volunteers will be out working in the tornado zone. Tornado survivors, our Tornado Relief Fund Committee is in the process of dispersing the funds. Tonight at midnight is the deadline to fill out an assessment survey, which is online at putnamcountytn.gov/survivors. You can click under the Tornado Relief Fund. We're expecting to have approximately 500 survivors who will or have applied for the funding. Remember, 100% of the relief fund will go directly to the survivors. We also want to continue to remind Mayor Shelton about the Census 2020 form.
Absolutely.
I saw where our numbers, we are a little above the percentage national, the statewide percentage of people returning their census forms, and we want to continue to be above that. So
Yeah, it's really easy too. Just
It is.
go online. It'll take you less than probably 5 or 6 minutes to do the entire form.
And there's 3 ways to do it this year. One way is you can mail in the form like you've been able to do in the past. You can go online, which is what I think you and I both did. It was
Yes,
very simple to
absolutely.
do. Or you can call at 844-330-2020. We need your help in filling out those census forms because all of our federal and a lot of our state funding is based on those
Absolutely.
census numbers.
Very important. So, listen, please continue to utilize precautions to protect yourself and others. Be supportive of one another. Wash your hands. Utilize physical distancing when you do go out. Make reasonable, educated, common sense decisions. As businesses open back up, we must change some habits so we can stay physically healthy. But remember, if you don't agree with the governor that places should be open, you have the freedom to stay home and be safe there. For the most up-to-date COVID-19 information, links, and resources, you can visit bettercookeville.com. Continue to pray for our country, our healthcare workers, and our small businesses and employees. And let's choose faith over fear. God bless.
Thank you, Mayor Shelton. I've been handed a note that evidently due to some technical difficulties that there may not have been audio on the TV at the beginning. So
Restate your numbers.
we're going to go back to the top and restate those numbers. Sorry, we try to work these things out every day, and they've done a great job. But sometimes we have technical difficulties.
That's right.
It's just part of it.
So the live show is.
That's what it is about doing live shows. So I'm going to repeat today's numbers in the comments that I made about those today for our TV listening audience on WCTE. Today, as of 2 p.m., our total number of confirmed positive in Putnam County is 95, which is 1 less than yesterday. Remember, the positive cases are based on the county of residence, regardless of where the people were tested. So the reason our number went down 1 today is because there's so many tests being completed statewide that sometimes private labs and different sources, they look at Cookeville and they say, okay, just because they had a Cookeville address, they're automatically in Putnam County. Well, Cookeville post
Cookeville
office
addresses are in what, 5?
Yeah, Jackson County,
Right.
White County, several other counties.
Overton.
So that's what happened. We had one that was listed for Putnam, which actually lived in another county. So they corrected that today. So we're down to 95. We also have had 3 deaths that we told you about last week. Those were all at the Signature Healthcare. Please keep those families in your thoughts and prayers. I was breaking the numbers down some too that we've looked at over the past week. I've been keeping stats every day on our numbers. If you look back to last Tuesday at our numbers, we had 92, and today we have 95. So we have only had 3 additional positives in a whole
Right.
week, which is a very positive sign, I think.
Mm-hmm.
Also remember that 50% of those positives that we have were from Signature Healthcare and their workers, where everyone in the facility was tested. Also in Putnam, we have completed much more testing than most of the other counties based on our population size, which of course is going to result in more positives. In the past 2 days, our health department has tested over 200 people just yesterday and today. So I'm not trying to downplay our numbers in any way, shape, or form. Just want to be as transparent as possible so that you understand them. Right now, it appears what we have been doing as a county is working, and we will continue to work to keep those numbers down. There are some positive signs also on the state level. The total number of positives for Tennessee today is 7,394, which is 156 more than yesterday, but by my stats, that is one of the smallest increases we have seen statewide in several days. Also remember, as Senator Bailey was saying earlier, that the number of people that have recovered from the virus is actually more than the positive number, and it's about 52% on a recovery. Right. I'm going to go ahead and mention the other counties in the Upper Cumming that have confirmed positives. There are Cannon with 8, Clay with 5, Cumberland with 55, DeKalb has 10, Fentress has 4, Jackson has 6, Macon has 30, Overton has 7, Smith has 11, Van Buren has 1, Warren County has 4, and White County has 4. Also, our drive-through testing at our health department here on County Services Drive is open Monday through Friday, 9 a.m. to 3 p.m., and the testing is free. So if you want to be tested, just come by the health department, drive by, and they will do the test. Again, Putnam County has 95 confirmed cases, which is only one more than yesterday, Mike.
I did have a question that was asked. It reminded me the pop-up clinics, pop-up 35 pop-up testing sites that were done. Someone asked why there wasn't one here. It's because we already have that being done here at our Putnam County Health Department. So that's why those were done in areas that were not already currently doing that at their health department or didn't have a health department. Right?
That's right. And also our health department did the drive-through testing Sunday afternoon. And so 6 days a week they've been doing the testing. So that is the reason. Is that where does Rick need to give his also?
Oh. Well, as I said, the governor announced yesterday that the stay-at-home directive will not be extended and will end April 30th. He said he would announce about the reopening of businesses by May 1st and some by April 27th. The fact is we still have freedom to follow directives or freedom not to, and then, of course, the consequences of those actions. We've said all along for the past 3 weeks now, almost 4, that to please listen, follow the directives, and take personal responsibility, and heed the guidance from experts, and use common sense so that you can protect yourself and your family and everyone else. There are no easy, clear-cut answers to this situation. On one hand, there's a virus that not really much is known about. It can kill people, spread easily. You can have it and not know it, or have symptoms. And there's no vaccine yet. On the other hand, there's an economic shutdown with issues such as unemployment, closed businesses, depression, poverty, suicide, domestic violence, hunger, and substance abuse. Heard from many people, frontline medical personnel at CRMC, pastors from local churches, business owners that are still open and some that are closed, employees still working at a location, or people working from home, and some that are out of work. There are folks that receive financial assistance and some that applied and didn't receive any. There are some emphatic on staying closed and some absolute that things must open. My point, everyone has a right to their opinion and beliefs. I believe the path forward is somewhere in the middle, kind of like driving a car with the foot on the gas and the brake at the same time. It shouldn't be political. It needs to be a people decision. We must manage and mitigate health and safety of our people while we open back up our economy and businesses and get our people back to work safely. Daily, hundreds have continued to shop at Lowe's, Sam's, and Walmart. People have spent their stimulus checks there. A small business can open with 3 to 7 people in it, and that poses even less of a risk, and they certainly could have used the stimulus spending there. As things begin to open, remember, you still have the freedom to choose. You can choose to shop there or not. You can choose to eat there or not. You can choose to attend church there or not. If you don't think it's safe, or you don't think the location is being socially responsible, don't go. Or if you want to stay quarantined or avoid crowds, then that is exactly what you should do. Stay home. I think we all realize there will be a new normal, and some of the measures that we've talked about, again, for weeks, physical distancing and potentially wearing a mask or covering and sanitizing, may need to be part of this new normal for some length of time. Mayor?
Thank you, Mayor. In closing, as we continue to say day after day, and we've said for several weeks to now, we're working together as a team to fight this dreaded disease. And our numbers show what we've been doing is working. And so we appreciate everyone coming together to make this happen. I know there are a lot of questions about what happens next with the governor lifting his executive orders, and we don't even know.
We have questions too.
We do, and we're going to make a lot of decisions on our local governments.
We all are.
We're working on that. So as we know the answers to some of those, we will be bringing you that data and that information. We're currently discussing when our city and county offices, so forth, will be reopening. Those no decisions have been made yet. We'll be bringing you those updates also. Just because things are going to reopen doesn't mean you need to let your guard down now. We must keep doing everything we can to fight this disease as we reopen. All the things we've been doing for the past several weeks need to continue, such as the social distancing, washing your hands, disinfecting surfaces. The main thing is to make good personal decisions. If you don't feel comfortable in going to a certain store, then don't go. Make good judgment decisions based on what's best for you and your family. As I've been saying, we will get through this. If we continue to work together and everyone does their part, it all comes down to taking individual responsibility. Mayor Shelton and I will continue to do live updates to keep you informed. As of right now, our next update will be this Thursday the 23rd at 4 p.m. unless something urgent should come up. Please continue to keep all of us, our community leaders, in your prayers, along with our city, county, state, and country. May God bless each and every one of you.